Do Medicare medical coders have ethical dilemmas? Have you ever wondered if Medicare medical coders face tough choices in their work? The answer is yes. They often encounter ethical dilemmas that can impact costs, patient care, and provider payments. Let's break this down to see what these dilemmas look like and why they matter. Medical coding is the process of converting healthcare services and diagnoses into standardized codes for billing Medicare. This task is not just about numbers. It involves making decisions that can affect many people. One major challenge is the pressure to upcode. Upcoding means assigning codes that indicate a more severe or costly service than what was actually provided. This practice is not only unethical but also illegal. It can inflate Medicare costs and damage the integrity of the healthcare system. Another dilemma arises when coders might feel tempted to code for services that were never performed or to change codes to maximize payments. This goes against coding guidelines and Medicare rules. Coders often have to choose between using a more specific, accurate code or a less specific one that could lead to higher reimbursement. This creates a conflict between doing the right thing and financial incentives. Additionally, coders may sometimes overlook incorrect coding done by coworkers to speed up the billing process. This can compromise the accuracy of data and fairness in Medicare billing. It is essential for medical coders to follow official coding guidelines from the Centers for Medicare and Medicaid Services and other professional organizations. These guidelines help ensure that coding is accurate, complete, and consistent. Ethical coding is vital for fairness to patients who may face out-of-pocket costs, and to Medicare, which funds healthcare for millions. It also affects providers who depend on reimbursement for their services. In managing Medicare costs and conducting medical bill reviews, ethical coding helps prevent fraud and unnecessary spending, maintaining trust in the Medicare program. To navigate these dilemmas, coders can follow several practical steps. They should adhere to comprehensive internal coding policies that align with Medicare requirements. Ongoing education and compliance training are also important to stay updated with coding standards. When unethical practices are identified, coders have a responsibility to report them to protect Medicare funds and patient interests. Ultimately, Medicare medical coders must balance accuracy, integrity, and compliance. Their role is critical in ensuring that the Medicare program remains financially sustainable while providing quality care to patients. By making ethical choices, coders help maintain the trust and effectiveness of the healthcare system.